I'm Dana Dart. I'm a registered nurse, an RN3 on the 4th floor here at Wesley Long Hospital. So I am an RN3, so in that position, I'm responsible for patient care. So I'm a bedside nurse or a clinical nurse, administering medications, assessing patients, working with physicians, other nurses, the transition of care, the case management team. And I also am involved in scheduling employees, nurse tech orientation, nurse orientation, precepting, and then some administrative duties as deemed necessary by my leadership. I feel like nursing matters to patients because we see patients when they're at their most vulnerable moments. So when they're the sickest, when they're not feeling well, and I just feel like just the spirit of nursing just helps people heal, and that it's kind of a calling that we have to be nurses, and it just takes individuals who recognize those needs. So my best day on the job, I would say is one where I make a great connection with a patient, and then it's really sad when you have people who come in and they have to come in on reoccurring admissions, but then when you build that bond and relationship, it's nice to see them progress, to learn who they are, about where they come from, what's important to them, more so than just the diagnosis that they have. We spend so much time focusing on the medical needs that sometimes we miss the whole person, and I just think that connectiveness is very important. I had always, as a child, I'd always been interested in a job that would help others. So at a young age, I think nursing or teaching was probably something that I looked to, but as I grew in middle school and high school and just got to see more about healthcare, I just became very interested in the medical piece of that. And so in high school, I had an opportunity to take an allied health science class. And from there, we did clinical rotation, and I like that bedside piece of taking care of people. So that's what influenced me to become a nurse. I think compassion for others is by all means a very important piece to have. That's just the piece that really drives you to want to be there and to help people. People who are very focused, I would say detail driven, because there's a lot of tasks that you have to know to be a nurse. Multitasking, and you have to just be able to take things in. You can't internalize a whole lot, but to process and to be able to multitask is very important. But by all means, being compassionate to others and caring about others and where they are in that moment. Anyone who's interested in nursing or any area of the healthcare field, very important to shadow. So reach out to people that you know who may have a career in nursing or another healthcare profession, and just ask if there's an opportunity where you can shadow, see what they do, ask questions, ask how much school it takes, what courses you need, and just kind of develop from there and to see what it's like to be in that field. I think your staff is the most important. I work on a progressive care unit here at Wesley Long, and it's a hard unit. It's not easy. It's not easy to see people that sick. It's a lot of tasks. It's very busy. A lot of admissions, a lot of discharges, but what makes it work so well is the team that we work with. We have bonds outside of the hospital. We build friendships. We spend time with each other. We get to know each other, each other's families, and just you just build a friendship, and it just makes the work much easier.